Hi everyone. I'm going to address the camera as if it is a patient, and then talk to them about the trial. And then afterwards, I'm just going to go through a few tips. In fact, I might do the tips first, and then you'll see how I do it during the delivery. The first thing is that we don't know if surgery works. And by we, I mean we as a community. There is community equipoise. And you have to realize that when you are a surgeon recruiting for a study, you are a researcher. You are no longer a surgeon carrying on their normal private practice or public practice or whatever it is. So you have to say, we don't know if this surgery works because we don't as a community. If you say, well, I would normally recommend surgery for you, but we're doing this study, it's all over. Don't even mention the study, just go and see the next patient. Because as soon as you say, I would normally recommend surgery, or I think that surgery will work for you, they've stopped listening and they're looking for where to sign on the consent form. The next thing is refer to it as a study, not a trial. To us, the words don't make that much difference, but to the patient it does. Patients don't understand the word trial, and to them it sounds like you're trying something out, or you don't know what you're doing, or they don't realise the difference between those two words. So refer to it as a study. Next point, don't mention the observational cohort. It's not another study that we're doing. The observational cohort is reserved only for those who decline randomization. Because if you say to the patient, well, we're actually doing two studies. One's a randomized one, one's an observational cohort where you just get treated like normal, they'll choose the observational cohort. They have to be offered the randomized trial first. And the last thing is highlight the importance of the study. You can, mention that it's been, ethically approved and things like that. But this is a very important study that will answer this question for patients in the future. So here goes. We'll see how I go. Start off with the diagnosis, the treatment equipoise, and then go on to the study. Hi, Mrs. Smith. So as I discussed with you, your symptoms, the complaints you have told me about, and the things that we've seen on your scans mean that you fit the diagnosis of lumbar spine stenosis very well. So in your case, the diagnosis is very clear, but the treatment is not clear. That's because there's been many treatments for this condition over time, including many surgical treatments. And unfortunately, we don't have good evidence whether any one surgery is better than any other type of surgery, or whether any of these operations are better than not operating. And this is because this condition changes over time. Sometimes the body adapts to this condition, and very often symptoms improve without any treatment at all. So now onto the study. I'm part of a group of researchers who are currently doing a study to find out if surgery is effective for this condition, to find out if surgery actually works. Now, the best scientific way of doing that is a placebo study. So what happens is all of the patients in the study get treated the same way, except for one thing. So all of the patients have surgery, they all have an incision, they all have an anesthetic, they all get treated the same way after the operation, they all get given the same drugs. The only difference is that during the operation, half of the patients will have the bone removed from around the nerves, which is the normal, typical operation that we do for this condition. The other half of the patients will not have the bone removed. That will be decided when the patient is asleep. And what makes it such a good scientific study is that the patient is what we call blinded. So the patient doesn't know what they had. And that way, the knowledge of what they had won't influence their answers to the questions afterwards. Also, all of the people that see you afterwards, including the other surgeon that will follow you up, and all the people that call you, won't know whether you had the real operation or not. So it's a truly blinded study, which is the best kind of study to find out if something works. Now, you have the condition that makes you perfectly suited to be on this study. This study is very important because it's a common condition and we've been operating on it for a long time without knowing that it works. Many other people do other treatments for this and they think they work as well, but none of us have very good evidence. And being on this study will help us answer this question for patients in the future. So what will happen? So if you agree to participate, you'll be booked for surgery as per normal. And as I said, you'll be treated like normal, but you'll have a 50-50 chance of being on the study. You don't get any direct benefits from being on the study, so you won't be paid to be on the study, but by the same token, you won't have to pay to be on the study. So there'll be no costs to you regarding surgeons' costs, hospital costs, after costs. That'll all be covered by the study. So if you're happy, what I'll do is I'll arrange for one of the researchers to contact you to talk about it some more. It's obviously a big decision. I don't expect you to make this decision now. So you'll have things to read about it. You'll have a chance to ask questions. You can come back and talk to me about it before we arrange surgery. I want to give you all the time you need to consider being on this study, and we need to give you some more information about it before you make that decision. I hope that helps. So that's it. That's just kind of like a off-the-cuff thing. You can tweak it to your own personal style. But to cover those important points, you start off, I say, the diagnosis is clear. The treatment is not. We don't know what works. We're doing a study to try and find out. You're the perfect patient for this study. This is what will happen to you if you're on the study, and what to do next. Thanks.